Tobacco Use, Trends, Health Consequences, Cessation, and Policies. Based on Introduction to Health Promotion, second edition by Laurie DiRosa, edited by Anastasia M. Snelling, Jones and Bartlett Learning, 2014. Tobacco use remains the single most preventable cause of death and disease in the United States. Since the 1964 Surgeon General's report, the culture of smoking has shifted dramatically from a time when smoking was socially acceptable to an era where smoke-free laws protect two-thirds of Americans today. Despite this progress, health promotion professionals continue to push toward the Healthy People 2030 goal of reducing adult smoking to 6.1%. Learning objectives. By the end of this chapter, you should be able to describe current trends and demographics of tobacco use, explain the health effects of smoking and secondhand smoke, discuss the impact of smokeless and electronic tobacco products, summarize the policy evolution that transformed tobacco control in the United States, identify evidence-based cessation and prevention strategies across settings, recognize current challenges to reducing smoking prevalence and industry influence. Section 1. Trends in tobacco use. Tobacco use remains pervasive despite decades of control efforts. As of 2020, about 19% of Americans used a commercial tobacco product and 12.6% smoked cigarettes regularly. Smoking is more common among men, people with lower education, those living below the poverty level, and individuals with disabilities. Adolescents remain a priority population. 4 out of 5 adult smokers start before age 18. Although teen cigarette use has fallen to about 1.5%, e-cigarette use has risen to nearly 20%, becoming a public health epidemic among youth. Smokeless tobacco use persists at around 2.3% of adults, mostly men in rural areas, often under misconception that it is less harmful. Products such as snus and dissolvable tobacco allow hidden use and sustain nicotine addiction. Economic impact. In 2018, smoking cost the US over $612 billion, including $240 billion in direct healthcare costs and $372 billion in lost productivity. Section 2. Health consequences of smoking. Smoking affects nearly every organ in the body. The 3 main disease groups are cancer, cardiovascular disease, and pulmonary disease. Cancer. Smoking causes about 30% of all cancer deaths. Carcinogens such as polycyclic aromatic hydrocarbons and nitrosamines damage DNA, trigger mutations, and disable tumor suppressor genes. Damage occurs through 3 pathways illustrated in Figure 4.2, page 68 of the text. Cardiovascular disease. 1/3 of CVD deaths are linked to smoking. Nicotine increases heart rate and blood pressure. Carbon monoxide reduces oxygen delivery, and oxidizing chemicals destroy antioxidants, causing inflammation and clot formation. Even light smoking or occasional exposure raises risk, only cessation reduces it. Pulmonary disease. Cigarette smoke destroys cilia and alveoli, leading to chronic obstructive pulmonary disease, COPD, and asthma. Tar and toxins accumulate in the lungs, causing chronic inflammation. Reproductive effects. Smoking impairs fertility and fetal development, raising the risk of infertility, miscarriage, and low birth weight infants. Section 3. Smokeless tobacco and e-cigarettes. Smokeless tobacco products contain 28 known carcinogens and cause oral cancer, gum disease, and tooth loss. They also elevate heart rate and blood pressure, increasing the risk of stroke and fatal heart attack. E-cigarettes deliver nicotine through aerosolized vapor and are marketed as safer. However, nicotine concentrations are often higher than in cigarettes, and youth appeal is driven by fruit and candy flavors. The FDA classifies e-cigarettes as tobacco products, but continues to struggle with regulatory oversight. Public health stance: harm reduction is debated, but US policy does not endorse smokeless tobacco or e-cigarettes as cessation tools. The recommendation remains complete abstinence. Section 4. Secondhand smoke, exposure and disease. Secondhand smoke contains over 50 carcinogens. It causes immediate cardiovascular damage, raises coronary heart disease risk by 25 to 35%, and increases lung cancer risk by 20 to 30% for non-smokers living with smokers. In children, it causes respiratory illness, ear infections, asthma, and sudden infant death syndrome. Clean indoor air laws and smoke free workplaces have halved exposure since the 1980s, but disparities persist in low income households. Section 5. Cultural and Policy History of Tobacco Use. The US moved from accepting to avoiding smoking through a series of research driven policy changes. Warning labels, introduced in 1966, strengthened in 1985, and modernized in 2020 with graphic photo based warnings that cover half of packaging. Tobacco 21. In 2019, Congress raised the purchase age for tobacco to 21 nationwide. Taxation. Each 10% price increase reduces youth smoking by about 7% and overall smoking by 4%. 1998 Master Settlement Agreement (MSA). 46 states sued Big Tobacco, winning $246 billion and imposing restrictions on advertising to youth while funding the Truth Initiative. The MSA helped decrease cigarette sales by 21% and transformed public attitudes. Family Smoking Prevention and Tobacco Control Act 2009 gave the FDA authority to regulate all tobacco products and ban youth-targeted advertising. Smoke-free laws. As of 2022, 28 states and the District of Columbia have comprehensive bans in workplaces, restaurant and bar bans. State and local policies. Grassroots initiatives paved the way for municipal smoke-free ordinances, now protecting over 60% of the population. Section 6. Effective Programs and Cessation Strategies. Healthy People 2030 Goal. Reduce illness, disability, and death related to tobacco and secondhand smoke through 27 objectives across 6 categories. Population-based strategies evidence shows the following are most effective: quit lines, higher taxes, smoke-free policies, mass media campaigns, and comprehensive state control programs. Truth Initiative, created under the MSA. This youth-focused campaign reduced teen smoking by 22% and continues with anti-vaping initiatives like This Is Quitting. Tips from Former Smokers, CDC. Real stories of smokers with disease prompted 1.6 million quit attempts and helped 100,000 remain smoke-free. Every try counts, FDA. Encouraged adults to keep attempting to quit. Expanded reach to 45 million smokers. Worksite initiatives, comprehensive worksite policies save about $6,000 per employee who quits. Examples include Quest Diagnostics, Healthy Quest, and Union Pacific Railroad Health Track, which combine smoke-free campuses, counseling, medication coverage, and peer support. School initiatives programs that teach social competence and refusal skills are most effective when combined with community engagement. West Virginia's Raise and Not on Tobacco programs cut teen smoking rate by 6 percentage points in 2 years. Community initiatives, community coalitions, and mass media can shift social norms when linked to policy change. The CDC recommends long-term funding, trained local staff, and free cessation resources. Individual interventions. The most successful quitters combine intensive counseling and FDA-approved medications, patches, gum, bupropion, or varenicline. Brief advice by clinicians and interactive digital support also improve success rates. Section 7. Challenges to reducing smoking. Access to treatment. Only 19 states provide comprehensive Medicaid coverage for evidence-based cessation treatments, and many employers still do not offer coverage. Addictive nature of nicotine. Nicotine acts on dopamine pathways, creating dependence comparable to heroin or cocaine. Withdrawal symptoms make relapse common. Tobacco industry practices. The industry continues to lobby against taxes and smoke-free laws while marketing flavored e-cigarettes and other new products to young users. Conclusion. Tobacco control is a public health success story still in progress. Prevalence has declined from 42% in 1965 to 12% today, but 480,000 deaths each year show the work is not done. The future of health promotion requires integrating policy, community, and individual approaches to achieve a smoke-free generation. Educational video based on Introduction to Health Promotion, 2nd edition, Chapter 4. All rights to the original text belong to the author and publisher. Produced by Mastering Public Health.